Hello, friends. My topic choice was an easy one: medically assisted treatment, or MAT, for pregnant and parenting women is something that I feel very passionate about because the bond between mothers and their children is something that I value in my personal life. Clinically, the mother baby bond determines brain growth, cognition, and even physical and mental health well into adulthood. But that's not the only reason that MAT is important to me. I live in the coastal Carolinas, where overdose deaths have soared by over 700% in the last 5 years. Brunswick, New Hanover, Pender, Carteret, and Craven County have greater than 24 overdose deaths per 100,000 people. The photos to the right are areas around my neighborhood. The upper picture is from my park, and the lower picture is from when a neighbor left their lunch on top of their car and drove away. I live in a racially diverse, middle class neighborhood. What you are seeing is not the story that the media typically likes to tell. These needles are everywhere. There's little information available to women with substance dependency disorder about medically assisted treatment. The biggest problem is that clinicians are also uninformed or misinformed about MAT and the benefits for women and their children. Currently, there are inconsistent punitive responses to women in the MAT program. And what that means is that in Western North Carolina, when you're admitted to the hospital and you're having a baby, you are able to room in with your baby and you're allowed to leave with your baby, like a typical pregnancy. In Eastern North Carolina, when you are positive for medically assisted treatment, despite having a prescription from your doctor, the baby is immediately removed and placed in foster care, as are any other children you have. And they can be in foster care up to a year depending on the investigation. The biggest problem with that is not only is it traumatic for the baby, subsequent children, and the mother, but it's also a huge risk for relapsing. In 2015, drug overdose was the leading cause of death in people under 50, more than cancer or car accidents, with most deaths occurring in people in their 20s and 30s. That information is crucial because that's when women are in their healthiest childbearing years. As you can see from the map, the problem isn't just in my community, it's nationwide. Substance dependency disorder affects mothers, babies, their families, and their communities. Our largest community problem is that women in recovery in their childbearing years receive no information or misinformation about medically assisted treatment. And it's compounded further by the clinicians being uninformed about how MAT works, and that MAT not only engenders compliance, but it also helps prevent relapse, reduces hospitalization, and supports family stability. Here are 5 quick facts about pregnancy and substance dependency disorders. So, about 6% of women report drug use during pregnancy, and pregnancy is that time in their life where people make a change to be healthier. So oftentimes they decide to immediately be abstinent, and because they know that drug use in pregnancy can lead to miscarriage, preterm delivery, and neonatal abstinence syndrome. But so does immediate abstinence. With maternal support and interventions, it really increases mom and baby's health. It decreases hospitalizations and out-of-home placements. These are a few of the conditions that can impact babies due to substance use. In my area, it's mostly opioids at this point. So now that you know a little bit about how substances impact mom and baby, and the kind of the problems in our community, let's talk about what medically assisted treatment means. So there is that piece about life-saving medications, and we'll talk about those medications in a few minutes. But there's also the resource and referrals that help remove barriers so that women can consistently continue therapy. If you don't have a place to live, it's difficult to get help. If you need assistance with utilities, or maybe there are legal issues, this is where those resource and referrals come in. And then there's counseling. Counseling helps women cope with emotional stressors and improving relationships. Behavioral therapy helps women understand their way of thinking and patterns of behavior. So when you think about these, counseling is more immediate needs, and behavioral therapy looks at life patterns to see what you might want to change. This is a list of the life-saving medications often used in MAT treatment. Next, we'll discuss their effect on the baby. So, methadone does not increase fetal abnormalities. This is one thing that women also worry about regarding MAT, that if I take medication, how is it going to affect my infant? It's not associated with low birth weight or abnormalities, and it's compatible with breastfeeding. So is buprenorphine. So also less frequent neonatal abstinence syndrome. The fetal risk is not greater, and it's also compatible with breastfeeding. The MAT Coalition for Pregnant and Parenting Women has 3 goals: to remove barriers to treatment by dispelling myths regarding MAT, engage the community in discussing those benefits for pregnant and parenting women, and advocate for consistent policies in hospitals that encourage treatment compliance and remove punitive action against pregnant and parenting women receiving MAT. However, we can't meet our goals of informing, engaging, and advocating alone. Without the collaboration of community partners, our goals would be difficult, if not impossible, to achieve. Potential cross-sector partners include medical providers, community groups, social service agencies, state and local legislators, religious institutions, and law enforcement. Our first step is to invite the previously mentioned agencies to participate. Each agency may choose a representative as well as determine their level of commitment to the organization. The first meeting will begin by discussing what resources that we can share and how their organizational mission aligns with the coalition. The most important piece of the coalition is to have women in recovery lead the coalition. It's only when vulnerable populations are empowered to make self-directed change that there is truly social justice. Who should be a coalition member? Representatives from the organizations must be passionate about our coalition goals. They must be willing to work with the population served, share strengths and resources, and maintain their commitment to the agreed upon goals to make the coalition successful. How do we know it's working? By evaluation. We should evaluate whether our activities, processes, and objectives line with our 3 primary goals. In our case, it's to inform pregnant and parenting women in recovery, their clinicians, and the general public, to engage the community in discussing the benefits of medically assisted treatment for pregnant and parenting women, and to advocate for fair and consistent policies for women undergoing treatment. We would do both a formative and a summative evaluation of our successes. A formative process may be, how are coalition groups engaging with the media? Then we can decide if the processes are meeting our needs, and if not, how we may change the process. An example of a summative review for our organization would look different. We would take a look at an objective like more MAT-informed clinicians within the community with a goal of maybe 15 per month. We might survey clinicians before giving an informational discussion and then use an exit survey to determine if the clinicians were more informed after the discussion. It's also important that we examine any unintended results, which for MAT may be a district attorney hearing about the benefits of MAT and working to change legislation. Evaluation really is key to growth and sustainability for organizations. I'd like to take a moment to thank all of my gorgeous friends who contributed their personal family photos and who believe that women having access to life-saving medications, counseling, and behavioral therapy makes a difference and supports community health. To understand more about medically assisted treatment and its impact on pregnant and parenting women, their families, and their communities, please visit the references above. Thank you for listening to my talk about MAT for pregnant and parenting women. Ready, set, advocate.